right, half a day and welcome to another episode, ladies and gentlemen. I want to thank you for watching wherever that may be. If it's on TV8, TV11, on KUAM News, Facebook, on Instagram, YouTube, wherever that may be. Thank you very much. And today we got a packed Zoom room here, so I'm going to go ahead and switch to gallery view. As you can see, we have a full house because there's much to talk about here. Joining me, we have Liz Duenas, we have Lillian Duenas, and Michelle Sasamoto. Now, ladies, something very important that you have really taken up as a cause, and Michelle, you've actually kind of made it your career, is talking about suicide prevention and giving help to those that need it. And recently, Lillian and Liz, you and I talked about this wonderful little project that you had, a little TV show that you put together with Inafa, Maolek, and another group of fine partners. So before we get into a lot of what you have going on, let's real quick talk about that special, Liz. I got to watch it, and it's something that hits home. And there are some statistics in there that really kind of drove the point home that, you know, suicide is a major problem, and it's something that we can all do to help.
Yes, Inafa Maolek is a nonprofit organization, and I'm a mediator, and I'm also chairperson of Inafa Maolek, and Lillian is our outreach coordinator to get the skit out. So mental health had a grant for us to do a skit regarding suicide prevention, and through the help of Ken Wolf, who was one of our previous youth mediator and performer, so he assisted us in putting this skit together. And it had scenarios of different problems that people have, but basically the skits had different storylines that reflected problems people have in life and how to overcome it, rather than taking a quick road down through the suicide process. So we have youth mediators that we solicited to come join the group and perform. And through Ken's help, we were doing all of this through Zoom, and it turned out very well. And it was funny that even in the filming of the process, we were filming individuals, and then KUAM assisted us in piecing it together. And they did a terrific job showing as if we were all in the same room. So congratulations to KUAM, because they really helped us in this process. But I'm really proud of the skits, and the team really did a good job, and I can't say enough. But again, the overall objective is about awareness, and Michelle can expound a bit on the local stats, which we discussed the other day. And Lillian is assisting in the process of getting the word out to all the different communities. So Lil, you may want to talk about who you've reached out to and her background as well.
If I may, I guess half a day, because this is going to be airing in different times, but on behalf of the Guam Behavioral Health and Wellness Directors, Teresa Ariola and Deputy Carissa Pangilinan, I just like to really thank Inafa Maolek, for being a part of our collaboration and partnership all these years, and just continuing to produce products that are very community friendly and family friendly, individual friendly. Part of how we were able to develop this partnership was through a grant called the Substance Abuse Prevention and Treatment Block Grant, which I manage in the department. And we're always looking for grassroots communities to help, again, in their cause, to align with our vision of just really helping people to live quality lives, right? And like Liz said, part of that is raising awareness through mental health promotion, because to me, I feel like that's where we need to start. Suicide is always kind of like a reaction of things that are happening in people's lives, whether it be a change in a life event, something may have happened to a person, and the emotional pain is so unbearable. And I know that we're talking about numbers, and you talked about that briefly the other day. And you can find this in our epidemiological profile, which is, I'll give you the website a little later, but just to highlight some of the numbers. Many times when we look at numbers, it seems either like it's so high, or it's too low, right? So depending on the perspective and how you look at it, but I always like to say, you took away the number and you started to replace it with names. There are going to be names of moms and dads, sisters and brothers, Ninas and Ninos, best friends, boyfriends, you know, the person that you last spoke to at the grocery store, at the gas station. And all of a sudden, even one number is too many. So when we look at it, part of our efforts is to reach our community, reach our families, reach our youth. I always like to say, right at our dinner table. And so again, it's about giving permission. You know, last year, Andy, the data shows that 44 people died by suicide. In 2018. And to me, that's alarming. That's a high number. And maybe I don't know one of them directly, but I know someone who knows someone who knows someone who knew that person. And the impact is not just on that immediate family and circle. The impact moves out to a larger scale, right? Co-workers, other affiliations, and then of course the whole island, because we're so small and we hear about it. So,
it is a ripple effect. You know, these things happen, and if you know you interact with someone on a daily basis at work or something, and then they do end up you know, taking their own life, you think, well, what could I have done? Should I have seen this coming? Could I have helped? Did they try to reach out and I was too busy? So it weighs on people emotionally, even if, you know, they're not the one directly affected by this.
Yes, and you know, with those individuals, when we look at it too, we want to talk a little bit about gender, because that's a question that comes up a lot. Like what are the rates, and you know, with gender. And when we look at our data, it definitely shows that males have a prevalence in dying by suicide, you know, as compared to females. So we're looking at that rate being higher. And then the age group is the highest rate at the moment is between the 20 to 29-year-olds. So when I look at that, I look at transition. You know, I have a daughter who's 20 years old. And that's a transitional period in her life where it's like, okay, you're taken care of by parents and by adults. And then all of a sudden, you're kind of like at that point where you're like, what do I do with my life now, right? And then there's those decisions. And I find myself doing it as well. When my daughter asks me for things, I'm like, you're an adult now. You know, you need to make adult decisions. But it's like, what are adult decisions? And how do we do that? So it's really fostering and nurturing that transitional phase, because now that age group, you know, they're thinking about careers, they're thinking about future, they're pressured with college, with jobs. Some even have their own families already. Some are in the military. So if we are able to get them at a younger age, like what Inafa Maolek is doing, and I know Lillian is going to talk about that population, whether it be in middle school to high school, it kind of plants seeds. It plants seeds in people's heads that, okay, well, maybe it's not really affecting me at the moment, but if it ever gets to a point, then I know that I can seek help from behavioral health. I know I can seek help from Inafa Maolek. I know I can go talk to my pastor or, you know, my clergy people. I know I can talk to my counselor. So it's just building some of that resilience and the awareness that if they shall need it, then they know that it's available and where to find it.
Yeah, people need to know that the help is out there. And Lillian, one of your jobs is kind of coordinating a lot of these individuals, the groups, the outreach. So how do you go about doing that? It's quite a big task.
Yes, I'm a retired educator. I've worked at the elementary, middle, and high school level. So I understand what Michelle's talking about, the transitional period, because there are a lot of stressors out there with them. And the teachers get training, you know, for suicide prevention, for bullying, for all these different things, but it's very difficult because at a personal level, depending on the individual, if they're having difficulties and they can't make a connection with some of these recommendations, talk to your counselor, talk to your parish priest, you know, that kind of thing. It's like they feel lost. And it's with this video, it's like just the awareness of, well, I guess I'm not the only one going through this period. And so that will help them to maybe reach out to someone of the same gender or age and maybe make the connection, and then having our mediators, our younger mediators, or our adult mediators, because again, it's not just the children that are affected. A lot of the adults or
or young adults that are just transitioning into the real world of work and all that, there are a lot of stressors. So with this in mind, I have contacted the Mayor's Council, so they're hopefully getting us on the docket for their next general meeting. And so again, it's one of those things, and I shared the fact that it's not just for the children, it's for the adults also, so that these mayors of our different villages can maybe share the information with their communities in how, you know, because the great thing about this is it's user friendly. You can go on YouTube, you can download it. And again, children, when they see it on their campuses, they can share it with their parents, you know, so it hopefully will blossom to be a family thing where they can share each other.
I hope so too. And you're right. It needs to be a family conversation because a lot of times, you know, people that go down that emotional rabbit hole, they feel isolated. They feel cut off from everyone in the world. There's 7.5 billion people on this planet, but you can still feel alone in all of that. And people just need to know that, you know, you can reach out. You need to, parents especially, need to have that dialogue with their children that, hey, if you're feeling a certain way, you need to talk to me about it. You need to talk to someone about it. Because we know sometimes having, you know, a conversation with your parents can be a little awkward.
Yes.
You know, you all have children, I'm assuming, and, you know, it can be an awkward conversation. So if the child is not comfortable with their parent, they need to be able to talk to someone, but they just have to know that people are there.
Yes. You know what I love about, if I may, because I watch the videos as well, right? Being providing guidance and oversight. I just felt like it is addressing the elephant in the room. And for many individuals and families, that is the hardest thing. Nobody ever wants to say the S word, which is suicide, right? And when we think about it, 15 years ago, the S word used to be, and if I may, because I think it's so relevant, it used to be sex. Yes. And we couldn't talk about sex. It was so taboo to talk about that. But now, at just right at the axis of your fingertips, that will pop up everywhere. And so the new S word is like suicide. And we need to make that be a normal conversation without having the put a stigma on it, but addressing the elephant in the room so that you don't have to. And I think that's what I love about the videos, is that it almost can resonate with the majority of the population. So it's just kind of like a baseline for people to start now saying, okay, we have permission. Somebody's saying we can talk about this.
Absolutely do need that, just to open that door to begin the dialogue if someone feels comfortable. And like you said, Michelle, I watched it. It's really genuine. It's got a lot of heart and it's fun. It's presented in a way that, you know, it's not some psychologist standing up there, well, you know, if you sense these things are wrong, you know. It's really presented in a way that kids watching with their parents can, you know, at least just have questions like, well, you know, what do they mean by this? Well, okay, let's talk about it. And as you, sure, Liz, go ahead.
What we did with, we had, the segment runs like 18 minutes, but then we also, if let's say a school wanted to present it or a teacher wanted to present it, we broke it down in segments so that they could take different parts or do it in series. So we do have the, again, KYM did this, but we had them break it down into different segments so that you could just play a segment every day or play the whole video, because the whole video is about 18 minutes long.
And, you know, I think this would be great for teachers, maybe, parents, to play in their classroom. And like you said, Liz, it's broken down into those 6 segments. Just, you know, play one. Okay, everybody, let's talk about it. What did you see? What did you learn? What do you feel? You know, things like that. So I think it could be a great educational tool. And Michelle, you know, kind of your job is going out, getting these grants, kind of finding the funding for these things. And when you do get that, we got approved for this funding. Okay, well, now what? So it's great having community partners like Inafa Maolek to be able to get these programs out there and bring them to fruition.
Absolutely. And, you know, we're always looking for new organizations out there. I try to do like annual inventories of nonprofit organizations that we can partner with. And, you know, there's all kinds of processes and how we are able to help organizations and also just give them some funding, right? Or to see, again, it always has to align with our mission. And so I just want to invite organizations, if you see a cause, if you feel like your message is on prevention and mental health promotion, to include substance use prevention, you can get a hold of us at the behavioral health, and we can look to see if we can help you with the grants we have, and if not, then we can point you in the directions with other type of funders, just so that we could help you to expand your own goals and objectives. Because at the end of the day, we call ourselves the state level agency, and that's just formality, right? The Guam Behavioral Health and Wellness Center. We cannot do it alone. I can't do it as a sole program coordinator managing the grant that I'm in. We have multiple grants happening. We also have one that's called the Guam Focus on Life, which specifically focuses on suicide prevention. Another one from our office is the Partnerships for Success, which again specifically focuses on substance use prevention. But at the same time, if we were to just do this with the 5 staff in my branch, there's no way we're going to be able to reach the population we need and, kind of change the climate and the environment and reduce the numbers. Because if you look, Andy, you could look at the data. It shows that Guam leads over the nation in suicide rates, right? And also in substance use. And a lot of it is with our young people. So we're really catching it at this time. And, the sad thing about it is that funding runs out. And so sustainability is always an issue. And that's one thing that our department continually tries to focus on, is that we're already looking at what's going to happen 3-5 years from now when this grant ends, right? Because fiscal year, we know that it only lasts for a whole year, and then it's time to look for new funding again. So we're real proactive at the department. I want to assure everyone that we're always on the lookout for grants, and we're always on the lookout for partnerships and collaboration. So I just want to, give that hope to the community. And
sure. Throw the number out there, Michelle, if they want to call.
You can call. Well, you can again ask for myself, and I may not be able to answer all the questions, like I said, but I do know some amazing people that might be able to answer. And then, so the number for our department is 647-5440, and that's one of the numbers that you can just call. You can call my office directly, because then I can refer people out. Would be 477-9082. And so when whatever your needs are, again, we'll find the match for you somewhere in the department or somewhere with our other partners.
There is help out there, and there is, if you're a small organization, grassroots, and, you're looking to make an impact, you need that grant money, make sure you call that number. And Lillian, I'm sure you can agree, just as everyone here, that mental health is health. We see so many people out there running the 5Ks, going to the gym, eating right, doing all those things to take care of the physical health, but the mental health sometimes suffers, and people don't take care of that. So, this is not one big issue. How do we kind of, get people to say, hey, mental health, that's very important to your health?
Again, it's all part of the awareness program and getting it out. I spoke with Lila Lujan at Bishop Gardner. She's the principal there, and she was saying that Juan Flores put it out to all the Catholic schools that Inafa Maolek had this program. So they viewed it, and she says now they're using it in their schools every Friday for their anti-bullying program. They're showing a lot of the videos to help students see things from a different perspective. And then those who are victims of bullying, again, to let them know that there is help for them. And then with the assistance from mental health, all of these different things are out there for them.
And it starts at home. I always say that. I mean, just with so many things, it starts at home. If, a kid goes to school and they're taught time and time again, don't bully, don't be a bully, and then they see their dad bullying someone on Facebook, it's like, well, they're getting mixed signals here. So everybody just kind of needs to think about these things and think about the impact they have on those around us. And those that are, suffering, there is help out there. I think that's the point of all of these projects, the grants, Michelle, what you do on a daily basis, and Inafa Maolek, the help is there. So before we wrap things up here, we'll go ahead and go around the room here. Liz, we'll start with you. What do you want to say to the people that do feel like they need help in some way?
Call someone, you know, either call an organization or reach out to a friend or family. With us at Inafa Maolek, we're mediators that usually when people have issues, they come to us through the courts or through personal referrals, and we kind of assist them with the process of resolving the issues. There's always solution to problems, right? It's just a question of how you go about it, and communication is the key. So to overcome issues, communication, that's the key. We've dealt with people who said, we haven't spoken in 5 years, and we had to wait for the attorneys. And then all of a sudden, there's a resolution. So communication is the key, and I'll leave it at that.
All right. Lillian?
Okay, now with the schools, I've talked to Dodea schools, public schools, the private schools, and a lot of them, they're aware of the suicide problem. Some of them are working on their own little programs to address suicide, and I'm sure that they work with mental health as well. But again, it's knowing that it's an island issue and working together. And if you have additional information that I can share, hey, let's collaborate, let's work together to make sure that we put the word out. So that's what I'm seeing in contacting a lot of the schools and organizations. It's like they're wanting to help, and they're happy to see that Inafa Maolek is doing something with mental health to put things out for the island. And it's sharing and moving forward with all the information that we have.
Yeah, the help is definitely out there. And Michelle, before we close with you, I'd like you to go ahead and give us your thoughts and throw out the crisis hotline number again.
Absolutely. So again, if you just need help and support, you just need to kind of, vent. There's a lot of pressure building up. Doesn't have to be suicide related. It could be anything, COVID related, changes that are happening. You can call the number 647-8833-34. It's a 24-hour hotline, 7 days a week. There's always going to be somebody that's trained to listen to you, to be able to just direct you to some resources. Again, and we've saved so many lives through that phone number. And, I've also helped people. My last thoughts for everyone out there is, I like to say, do check-ins. And what I mean by that is really think about it. We have to be strategic. We have plans for fire escapes if we should have a fire. We have plans for if an earthquake were to take place, a tsunami and all that. And I just like to say, be prepared to handle hard things in life, because life happens, right? And do check-ins, but at the same time, develop something. My daughter, when she was really young, she was in elementary school. I already knew that although I wanted to be the only person, the one person, the first person that she came to when she had to deal with hard things in life, I knew that I was not going to be that person all the time. So what I did was, first of all, I let her know that it's okay. If it's not me, it's fine. But name 2 or 3 other people that you could talk to. Name 2 or 3 other places that you could go to. Because what that did for her now was put that extra tool in her toolbox. And she's like, okay, I can't tell mom this. It's too hard. It's embarrassing. It's going to disappoint her. Then guess what? I can call my auntie. I can call my grandma. I can call my teacher. So developing that initial plan. But, moms and dads, this is to you, okay? This is on me as a mommy hat on. We don't know all the answers. And honestly, sometimes we disappoint our children unknowingly. And we are not always going to be the saviors in our children's life. And sometimes when we feel like we're protecting them, we could actually be hurting them. And what I mean by that is sometimes we need to get out of the way, and we need to trust that our children also have the ability to find that trusted person, because that's what we tell them. And so you're not alone if you feel that way, but it's okay to give your children permission to talk to someone else. It doesn't mean that you're a failure as a parent. Right. And that's what I like to say. Thank you.
And the help is there. You just have to reach out, whether it's to the crisis hotline or anyone else in your life that you're comfortable with. And, it's not a light switch where, we're going to fix the problem tomorrow. This is something that we all need to do, and it's going to take a constant effort. And I appreciate all of you all of your team members, everyone involved with these projects and like them for doing what they can. I want to thank you all for joining me here on the show. Appreciate it.
Thank
Thank
you
you.
so much.
Thank you very much. That'll do it for this episode. Thanks for watching. All right.